Good evening.
Good evening.
Hello. Thank all of you brave souls for coming out on what was not a perfectly sunny day. We're delighted you're here. We're delighted our speaker is here. She risked every kind of travel nightmare imaginable to get here from New York. Delighted that you made it. I won $5 on the bet, so you can our speaker tonight has what my grandmother would have described as not one but two big jobs. She is the executive director, president, and CEO of LeadingAge, and she's also the executive director of the International Association of Homes and Services for the Aging. And I'm very excited to learn from her tonight. We are delighted that you're here, and I'm going to stop talking and you're going to start. Please welcome Katie Sloan.
It's great to be here. Thank you all for coming out on a rainy, stormy, kind of an ugly night, isn't it? First, I would be remiss if I didn't start by thanking you for sharing Carol with us at LeadingAge. She serves on our board and has for a number of years, and we are a better board because of her involvement, so I thank you all. But I also want to thank you for all that you do here at Jewish Home Family. I know that all people and families who are touched by your services are indeed fortunate. So what I want to do this evening is tell you a little bit about my journey. I want to reflect a little bit on the environment that we are in, broadly speaking, and share some of LeadingAge's priorities over the next months, probably years. And then I'd love to hear from you all. So when I was just out of college, I worked in the United States Senate, and I worked as a very enthusiastic and a very ambitious legislative correspondent, which meant that I answered constituent mail. And this was handwritten letters, typewritten letters, no Facebook at the time. And my job was to write very cogent and meaningful letters to constituents. That wasn't enough for me, so I volunteered to help with hearings. And the senator that I worked for was chair of the aging subcommittee. And this was one time in our history when energy costs were exorbitant, really high. And I sat through hearings, time and again, hearing these devastating stories about people having to choose between food and heat and medicine. And at the time, it just rattled my sense of social justice, wondering why we as a nation did not feel a moral obligation to provide for those who had worked all their lives to make families and communities strong and vibrant. So I'm here today because I felt then, as I still do, that I wanted to do my part to make the world a healthy, safe, and dignified place in which to grow old. So fast forward to today. We are in a vortex of change all around us. Healthcare, technology, globalization, politics, economics. The pace of change is growing faster and faster, and it is rocking our world. The challenge for LeadingAge and for organizations like yours is really to drive transformation that will pave the way for a successful old age. So in addition to changes in policy and practice, we need to change the conversation. We need to change the conventional wisdom about aging. In my mind, we have three choices. We can hold tight to the past. After all, it's led to our success today. We can assume an endless series of todays. Or we can jump headfirst into and embrace an uncertain future. I think you can probably guess where I and LeadingAge stands. We need to be at the forefront of shaping the future. Because I think that if we fail to do this, we fail our residents, we fail our clients, and we fail the good people who care for them every day. And we fail them now and years to come. So we have big issues to tackle. And our big hearts need to become brave hearts. It's kind of an interesting paradox that we're living in. More people are living longer, and by some estimations, in better health, on the one hand. On the other hand, longevity is straining our social structures, our institutions. It's raising questions about affordability and long-term viability. So LeadingAge has chosen to hit this paradox head-on. Our agenda focuses on how we plan for later years, how we pay for later years, and how we ensure high-quality services and supports that are accessible to and easily navigated by people as they age. We have 4 broad priority areas that I want to tell you about tonight. And the first is a big bucket of policy changes. We're looking for public policy changes in financing of long-term services and supports, of overcoming the acute workforce shortage that we face, of addressing the severe lack of affordable housing, and for wrapping our heads around these changes in payment models that are happening before our eyes. So let me talk about long-term services and supports financing. And it's on my mind because tomorrow we are releasing a study that we've been working on for the last 2 years, which I'm pleased to see come light of day. Right now, people in this country are paying for long-term services and supports in one of 2 ways: out of savings or their children's savings, or Medicaid. There is a small percentage, single digits, of people that have long-term care insurance, but it's pretty insignificant in the scheme of things. Both savings and Medicaid are strained now, and they're unsustainable in the future. So we at LeadingAge have commissioned recent research that tells us that on average, individuals, not households, individuals over the age of 65 will spend at least $138,000 on long-term services and supports. This includes home care, it includes home modifications, assisted living, nursing home care, any and all kind of possible services and supports, depending on their need. So you juxtapose that, $138,000 at a minimum, with the mean household, not individual, savings of $77,000 for people aged 65 to 74. And net worth, including a house, of just over $200,000. And you can see the path we're on. More and more people will become impoverished, and Medicaid will continue to buckle under the strain. So, for the last 5 years, LeadingAge has been leading a conversation in Washington. We have done studies, we have done economic modeling, we have looked at actuarial projections, and we've narrowed our focus from 7 possible pathways to solve this problem, down to 2 or 3. And it's widely agreed among our policy colleagues in Washington that the ultimate solution is an approach that covers the catastrophic expenses associated with long-term services and supports incurred over 3 years or more, and targeted particularly at middle-income individuals. It's also widely understood that, as with any major initiative that includes federal involvement, it will take quite a number of years to see the fruits of our labor. But labor we will. We are now seeking champions in Congress, allies in state capitals, and really a movement by consumers demanding change. We will continue to deepen our understanding of the choices within and the details of a workable solution to cover these catastrophic expenses, short of spending down and becoming eligible for Medicaid. But we also know that individuals and families need relief from the expenses they are paying out of pocket, from savings they don't have, or from wages that could be used for other basic necessities. We are looking to the private long-term care insurance market for some creativity in refining their products and benefits. And we're also looking at new savings vehicles. It's interesting to me that we have set up savings mechanisms for college. And I believe there must be some parallel mechanism for long-term services and supports that we don't have in place today. But we also need to bend the cost curve for services and supports through integrated approaches and through a healthy dose of wellness and prevention. I certainly don't need to tell you that long-term services and supports are expensive. But ultimately what we're seeking is a different future for all, for younger people with disabilities, for families, for paid and unpaid caregivers, for employers, for the middle class, for providers, and for state and federal budgets. The status quo is not fair, it's not rational, and it's not sustainable. A second big policy issue for us is workforce. The lack of a well-trained, committed staff that are long tenured is an issue today. It's an issue in the US and it's an issue around the world. Wearing my International Association hat, I hear it from providers all over the world. Attracting, retaining a qualified workforce. The demographics are working against us. But so is reimbursement that doesn't acknowledge the indisputable connection between quality and staffing. And, in my mind, a wholly undeserved stigma about working with the elderly. So in my mind, we need to establish a Teach for America equivalent for aging services, attracting passionate young people to our field, where we need apprenticeship programs similar to those in other fields. We need to look at immigration opportunities because the workforce in aging services is quite fluid across countries and oceans. We need to look at building cultural competence and at job training programs. And in doing so, we need to shift the paradigm from human resources as an expense on the balance sheet to human resources as an investment. Big initiatives to advocate for, but we have to if we're going to deliver the high quality care and services that people deserve. A third big policy issue is affordable housing. Too many seniors are on waiting lists and will never see the walls of the apartment that they seek. Our supply is inadequate now, and it's going to get significantly worse without a big jump start on production. And any and all housing for seniors should be wrapped with services to allow people to live safely and securely. The LeadingAge Center for Applied Research has done groundbreaking work on models and approaches to housing with services that are effective, that save money, and that demonstrably improve quality of life. So we need to make this normative, both through policy and practice. And finally, payment reform. If not fee for service, then what? And that is the question. We're rapidly finding ourselves in the midst of managed care, bundled payments, ACOs, value-based purchasing, and all kinds of permutations of these. No question, it is stirring up the status quo. And what it means for us is that we need to measure and report quality. We need to understand our residents and clients. We need to know our outcomes. And I think we need to beat our chests about our value, our track records, and our expertise. Relationships with the so-called health system are not a nice to do anymore, they're a need to do. And from my perspective, they need us as much as, if not more, than we need them. So this is a broad policy agenda, it's a pretty bold one. It'll take us years, but we're seeking real change. It will help our members do what they do best, today and in future years. So first big priority for LeadingAge is these policy changes. The second one is around economic security. High-quality aging services and supports need not be solely the province of those with the good fortune to have resources. If trends continue, the number of poor or near poor seniors will double to 4.3 million people by the year 2022. So if we as not-for-profit organizations don't serve those of lesser means, who will? So the question for all of us, for the LeadingAge family, is how can we extend our missions to serve more of those of lesser means? The market is vast. So the question is, what are the possibilities? A third priority for us is around social enterprises, like yours. You were born to innovate. And when I talk about innovation, it's not necessarily the big eureka moment. It's smaller steps that add value and improve outcomes. It's naturally occurring innovation. But it needs to come out of a culture that is perpetually dissatisfied with the status quo, that always believes that there is a change or an improvement that can be made. Nonprofits, I think, are wired to innovate. I think it's in our DNA, because we're constantly looking for a better way to serve, to care, to manage, and to lead. The Jewish Home exemplifies this over the years, and we're proud to have you as an exemplar in our membership. Finally, a word about community, and particularly community conversations. You add strength to your community, whether it's your four walls or the neighborhoods, cities, and towns in which you are located. You may be the largest employer in your area, and you're perfectly positioned to start a conversation about aging, to debunk myths, to challenge stereotypes, to celebrate this stage of life, and to ensure that our communities continue to be good places to grow old. Whether it is following the moniker of being age-friendly, or dementia-friendly, or something else entirely, there is no question in my mind that the LeadingAge family has the passion and the expertise to lead the conversation. It's interesting that ageism is one of the last isms, and it's the only ism that everybody will experience. Think about that. At the LeadingAge conference in Boston this past fall, we built a wall in the middle of the Rose Kennedy Greenway. The wall said, "When I grow old, ... And we invited people, anyone who walked by, to offer a thought to finish the sentence. Thousands of people wrote on the wall. People said, "I want to be just like I am now," or "I want to travel more. I want to learn to play the violin." I'd like to believe we started a conversation, and one that must continue, about growing old and a heightened sensitivity to its attendant challenges and opportunities. A conversation that will lend strength and urgency to addressing the priorities that I have laid out. A conversation that will create a mandate for change. Since it's an election year, I think these conversations need to start with candidates for elected office at every level. How are they thinking about an aging society? Or are they thinking about an aging society? Can we engage them in our policy agenda at the federal or the state level? Elections, they offer a unique opportunity to try to get the issues, our issues, front and center, and we need to take advantage of that. In due course, over the next 10, 20, even 30 years, our society, Jewish Home Family, and our other member organizations will probably become something that we can't even imagine today. And that something will depend on how we lead as providers and experts today. Leadership can't be constrained by floor plans and staffing patterns, business models, zoning restrictions, capital markets. It really needs to draw on our most creative ideas and tap that innovation gene, embrace our inner Edison. I know we're up to the challenge. I've witnessed too many examples of extraordinary creativity, determination, and discovery on the part of LeadingAge's remarkable members to have a shadow of a doubt. Big hearts, willingness to share, eagerness to learn, and deep fellowship characterizes the LeadingAge family. In closing, a quote from one of my favorites, John Gardner, who once said, "There occurs at breathtaking moments in history an exhilarating burst of energy and motivation, of hope and zest and imagination, and a severing of the bonds that normally hold in check the full release of human potential. A door is opened." I really do believe this is one of those breathtaking moments in history. I believe a door has opened. I hope you'll share with me your ideas, the challenges you perceive. Does my agenda resonate with you at all? We want to support your work here in northern New Jersey, now that I know where I am. So I hope you'll join our big hearts. I hope you'll take advantage of what I believe is our collective energy. And I hope we can walk through this door together. So I thank you for having me, and I'd love to hear from you. What keeps you up at night? What makes you most optimistic about the future? Thank you.
We're going to take questions, so I know this is not a shy group. By all means, who's got a question?
Yep.
She wrote out the question for me, so I'm just going to read it. No. We're in sort of the silly election season now.
Yeah.
And I'm wondering, in your experience, whether seniors, at a certain point in their, and this is an overgeneralization, but is there a point at which someone who grew up as a Republican or a Democrat actually becomes a senior and starts thinking and voting and responding to senior issues that transcend sort of what had been a lifelong pattern? Because, you know, it's clear that these issues are ultimately going to be very impactful in terms of what federal response to this